The goal of the core muscles when you have back pain is stability and stiffness. And it's not my back is stiff, it's the ability for the muscles to hold the spine in place. And this is important because when you activate the core, you create a stiffness that can last up to 2 hours that will give you added stability for whatever you're doing at the moment, whether it be a sporting event or working. So the key here would be to be able to do your specific core stabilizing exercise for your bias before you have to perform an activity that may aggravate it. And this came up because somebody said that they were sitting a lot more than normal. And because of all this sitting, that they were getting a little bit more back pain, but they also weren't doing their exercises because it required more time that they didn't have. But the key would be to do your specific exercise for your bias that may be aggravating you when you're doing the activity, like sitting. A lot of extension bias patients have sitting. So the key is this can last up to 2 hours, this stiffness. Sprinters, they do core work before they sprint and they run faster times. They've done studies on this. So when your core is stable, it adds the stiffness that you need for the activities. That's the key. So understanding what causes the pain and what you can do to live a happier, healthier, pain-free life is what gives you hope. That's the whole idea here. The key is you can get better. There is hope. So we've seen this a lot. 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone there is a disc. And what can happen is that disc can move. Now, the disc functions best when the stresses are distributed evenly in all directions. And what happens sometimes is the muscles aren't doing their job, or one muscle's tight and one muscle's loose. We call that reciprocal inhibition, or altered reciprocal inhibition when it becomes permanent. And it changes the load on the disc. So the key for a better functioning disc is to make sure that the load is distributed evenly, which is what the core does for you. But you have to start in the right direction, because we know when there's a tear in the annulus, you get an annular tear, the disc will start to migrate out. You'll get the bulge, you get the herniation, but it's really the result of the muscle imbalance, or the strength indifference, or the fact that the muscles just aren't doing what they should be doing. And that core muscle really prevents the motion to the disc and the motion to the spine. And what we know is there's two directions. There's the functional the flexion bias, and there's the extension bias. And your movement patterns will dictate what's happening to the disc. We did the studies, 5,000 MRIs. And we found out some people, when they bend forward, what happens is it makes the herniation worse. So what do you want to do? You want to make sure you're not bending forward. So what do you do to prevent bending forward? You strengthen the muscles in the back. You create strength in the back by doing the core work for the back muscles, your extension bias. If you sit in a chair too long, what happens is the spine starts to flatten out. So what you want to do is you want to make sure that you have stiffness. Okay, it's not, oh, I feel stiff, I can't do that. The stiffness comes from the activation of the muscles, which actually comes from the nervous system, which is neural drive. And I'll do a video about that tomorrow, because that's important, because there are certain things you can do to increase neural drive, and there's things you can do to decrease neural drive. And there's certain things that you do that you need more neural drive, and there's certain things you do less neural drive. Okay. So without confusing you too much, if you're an extension bias, before you do the activity that you're going to do that might require you to flex or just to use your spine period, it's a good idea to do your extension bias exercise, which would be bird dog. Okay? It's the bird dog that gets these muscles going in the right direction, gets the muscles sort of holding everything in place and prevents that motion, because it's the added motion to the spine, to the disc, that starts to cause the nucleus to push out. So there's certain activities you do to stabilize the spine in the extensors, and there's also activities that you do for the flexors. If you're a flexion bias patient, do your ab curls before you have to do the activity, whether it's golf or going to work or whatever it is. If you're getting aggravated by doing the activity, you perform the core strengthening exercise. You don't have to do all your exercises, just do that one for your motion. Okay, just do your bird dog or just do your ab curl. If you're sitting, sometimes what happens, I had to sit 8 hours a day. By 4 hours, I was starting to get a little bit sore. Okay, do your bird dog. If you're extension, do your ab curl. If you're flexion. Okay, we have to get up and walk around. We've talked about those things. All the, I don't want to call them tricks, because it's really just sparing the spine of all the stress. The spine sparing activities, one of them is actually doing the exercise. By doing the exercise, you can create the strength and the stiffness to get through the activity. It will physically make you stronger, and quite frankly, if you're an athlete, it'll make you a better athlete. So we've talked about the different phases, but right now we're talking about the stability and then creating the endurance to have it last. And the only way to create the endurance is to do the endurance activities, the endurance strength. Okay? But this stiffness and stability will last up to 2 hours. And it'll benefit you for all the things you do, whether you're sitting, standing, sports, walking, bias specific. But again, it was the patient that was sitting all day long. They said, you know what, I haven't had a chance to do my exercise. My back's a little worse. What should I do? Well, if you're not going to get up and move around, which is what you're supposed to do your exercise. Do the bird dog. Okay, that's the key. Do them throughout the day if you have to. That's what gets everything back in place. So what are we looking for? Strength, endurance. But the back pain comes from the capacity shortfall, meaning you've been sitting too long. How do you do that? Add the strength. Add functional strength. And by doing that, you can get the herniated discs to go away and you can live your life pain-free. That's the key. Do your exercises before you have to perform the activity. We've seen this thousands and thousands and thousands of times. Okay? Do the activities. Do the work. Get the results. Do the core exercises. We have a back program. If you're suffering with back pain and you're not getting better, these are exercises that you can do at home to help get your spine in the best position and create the resilience and the strength. You do these activities every day. Okay? It's a weekly program. Every week you get video exercises, and then the next week you get more exercises. Okay? It's not difficult, and we coach you and we walk you through the process and we educate you. This video is an educational video so you understand. The more you understand about your spine, the more likely you are to eliminate the problem. That's it. It's simple. It's not hard. So, totalbackpainrelief.com/10x order. The program is called 10x. Okay? We'll put a link up here. You can push a button, and then we'll put a link in the description. If you're having back pain and you're not getting better, do this program to get your life back.